you know when your brain injuries happen?
I'm not aware of the ones that Dr. Amen seems to believe that probably likely happened when I was younger.
So you noticed primarily the sleepiness in the front part of the brain. Was there anything else that was significant?
Her emotional brain was really active, because when you experience trauma again and again, it takes the limbic or emotional part of your brain and it activates it.
This was a situation where you experienced memories that were locked off for 25 plus years. Was it like they had happened yesterday, or were they like distant memories for you?
It was like it was happening now,
Right.
if I'm honest. It was as if I got in a time machine and I was in that terror. So it was very present.
Were you in a relationship during this period, during this time?
Thankfully, no, not for most of it, for his sake. But I did meet someone and I kept pushing back. We did end up having a little bit of relationship for a few months, and that was when the reintegration moment happened. I attribute it to him. I believe he's a guardian angel who came into my life for that moment. I closed my eyes and everyone in the room integrated. And that was when I called my doctor and was like, what's happening? She was like, oh, did someone find love? Someone found that there's something bigger than fear.
When these memories are being pushed down and then come back, what's happening neurologically at that point?
Well, what we see with trauma is their emotional brain becomes lit up, and the brain works through association. So a smell or a tone of voice or a look from someone else that has nothing to do with it all of a sudden can trigger, re-trigger that emotional brain to fire up, almost like a seizure. And most people who have dissociative identity disorder, they actually end up with 5 to 7 other diagnoses first. But when the standard treatments aren't working, you need to delve deeper. And it would have been hard with you because you didn't remember the early abuse. It's like, no, everybody was fine.
Yeah, and that's difficult when you have to rely on the patient to be a reliable historian.
And your brain is always listening. There's how to rewrite your own story. And I have people go year by year. And it's interesting when they actually take the time to go year by year, what good thing happened, what stressful thing happened, it often begins to trigger those significant memories. And the ACE test, which is the Adverse Childhood Experience test, she scores an 8, which above 4 is associated with all sorts of bad things, including dying early and a higher risk of suicide. This is one of the most important public health issues we can deal with. When there's a lot of adverse childhood experiences, we have to intervene early because it not only protects them, it protects their babies and their grandbabies.
At this point, do you consider yourself integrated?
Yes, sir. I feel fully integrated at this stage.
What is the best treatment for AnnaLynne and her brain at this point?
Well, so now we got to get your brain healthy, the right diet, and then exercise. And meditation actually has been shown to activate the front part of the brain. I published 3 studies on a Kundalini yoga form of meditation. It's beautiful. It's a singing meditation that increased blood flow.
Kundalini is actually what I used to coincide with EMDR. That was the somatic experience I started with.
And you had talked about EMDR a number of times, eye movement desensitization and reprocessing. It's a very effective treatment for trauma. And it helps calm your emotional brain. What I love is you've turned the pain into purpose. And I'm just so proud of you.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.